Policy, and today we have a presentation from Bianca Wilson. The usual logistics before we start. Excuse me. If you're logged on, please be in the audio mode using the telephone, and please avoid using cellular or cordless phones if possible, because there's often sound problems using those equipment. And if you are having a sound quality issue, hang up, call back in, because sometimes that clears things up. Lastly, we are recording this webinar, and the link for the recorded webinar will be sent out as usual to all the members of the network and posted on our getrealnetwork.uic.edu website. Next slide. At the end of this webinar, my colleague Kristen Weber and I will collect questions and engage in a question and answer session with Bianca. So if you have questions during the course of the webinar, please send them in using the chat function. And also, once we engage in the discussion afterwards, feel free to continue to send in questions. We will send a follow-up email after the webinar to all of you, requesting you fill out a brief survey rating the webinar and giving us responses about your ideas for future webinars that we may provide. So it's now my pleasure to introduce Bianca Wilson. Dr. Wilson is a community psychologist and a senior scholar of public policy at the Williams Institute in the UCLA School of Law. Welcome, Bianca.
Hi, thank you, Bill. Good morning and good afternoon to many of you. I really appreciate being invited by the Center for the Study of Social Policy to do this talk with you today. Again, the title is There Are Way More Than 3, Estimating LGBTQ Youth in the Foster Care System. This is a not-so-subtle nod to Angela Irvine's great work in the juvenile detention research area. Really, this is all about battling the invisibility of LGBTQ youth in the services areas. So her work very much informed what I'll be talking about today. And also I want to acknowledge, before going on, my co-authors for the report that today's talk is based on. Please ignore why, I don't know why we keep seeing this little message. And as well as many collaborators, to say the least, Williams Institute staff, the Los Angeles LGBT Center, the DCFS here in Los Angeles, as well as many providers that helped make this project possible, and including other individual consultants like Jody Marksimer and Emily Graytak at GLSEN, who helped inform the project as we went along. Just a quick note that anything I say, you cannot hold the Children's Bureau accountable if you don't like it. So let's move on. I know we were running a little late for some technical difficulties I was having. So just to tell you a little bit about how we got to this project. This research study that the Williams Institute conducted along with Holarchy Consulting, we were contracted by the LA LGBT Center. This is it was part of their RISE project that that many of you heard about a few months ago, I think this summer. They did one of our webinars. And so this was a research component of RISE, which is one of the permanency innovation initiative projects. And this is the one project that was focused on addressing the needs of LGBT youth in the foster care system. And this project has been a collaborative between multiple agencies. And the charge given to the Williams Institute by the LA LGBT Center was to essentially identify a method and implement a study that measured sexual orientation and gender identity among youth in foster care. So that's really the project that we'll be talking about today. So just to back up a little bit, thinking about what does a lot of our current research say about LGBTQ youth in foster care. We've heard a lot of really great studies through the Get Real Network series. In all, a number of studies or reviews by practitioners, scholars like Gary Mallon, Shannon Wilbur, Caitlin Ryan, Jody Marksamer, and other colleagues have noted the challenges that LGBT, and in particular most studies focused on LGBT, youth in foster care experience. And some of these unique issues have included rejection from their families of origin, or a lack of acceptance around their sexual and or gender minority status, that they have been moved around to multiple placements, or as well as more likely to end up in congregate care settings, a number of challenges to reunification, as well as anti-gay and anti-trans experiences with peer staff and foster parents, meaning negative experiences within the foster care system. But I also I want to note that a number of these studies have highlighted that we also see resiliency. We see that some youth report positive experiences from staff and parents, as well as we see some opportunities for how to change the system. So what I really want to highlight is that a common feature throughout many of the pieces of research that we have out there, both qualitative and quantitative, is that there has definitely been a consistent theorizing around how many LGBTQ kids there are in the system. And a common claim or a question that has been raised is whether we are looking at disproportionality, a disproportional or overrepresentation of LGBTQ youth in the foster care system. And this has been a unique sticking point in that we've been able to document disparities, and it may be true that there are both disparities and disproportionality, or it may only be true that disparities exist. And this issue of disproportionality really also speaks to kind of highlighting problems with invisibility of these youth and the lack of ability to make arguments for the need for targeted or specialized services or system-level work that addresses oppression that they experience. So when we talk about disproportionality, I think before we can kind of get into the study results and the study itself, I want to step back a little bit and say, well, compared to what, right? When we say that, when a number of previous research or advocates have said, it just seems like there are more LGBT youth than we might expect in the general population, what are we really comparing that to? And so these next two tables that I have present what we know about how many youth in the general population are LGBT. And all these studies are not designed to speak to one another, so pooling them together has its own methodological challenges, but nonetheless, you can see in the far left column that if we look across various studies on sexual orientation, so this table is just those studies that have looked at sexual orientation in the general population, and they've done it in a number of different ways, either national or city-based or just multiple cities. We see the estimates seem to range about a percentage between 4 and near 8%. So, again, this is looking at about middle school to high school years, or, early to later adolescence and young adulthood. These are the estimates that we have so far. So that gives us a sense of anything we find in the foster care study. This is what we're comparing when we talk about the general population research. And then thinking about transgender status, for trans youth, keeping in mind that we actually have no national probability sample to compare to, but we do have at least one city-based probability sample and some other really representative studies that have made an effort to estimate the proportion of youth who identify as transgender or could be categorized as transgender. And here we see estimates between 1% and 3%. So no data like this existed for foster youth who are still in care, and then in particular under the age of 17. So the question before our project was how to assess the proportion of foster youth that are LGBTQ, and to think about whether these values, these estimates lead us to conclusion that there appears to be disproportionality. So bringing us to the current study that I'll describe, the Los Angeles Foster Youth Study, again, conducted as one of the components of the RISE project. We had 3 primary aims. The first was to assess the proportion of foster youth that are lesbian, gay, bisexual, transgender, and questioning. In this case, this is what the key refers to, youth in the LA foster care system, essentially asking how many are there. We also wanted to look at disproportionality and answer this question, are there more than we would expect, right? So, for example, if what we found is that the distribution looked very similar to the general population, we would say, yes, there are LGBTQ kids in the system, but no, it doesn't appear they're disproportionately represented. And then we also wanted to make sure that we didn't lose sight of the significance of identifying disparities, whether disparities existed. So adding to the existing literature that has documented a number of disparities between LGBT youth and non-LGBT youth, we also wanted to know, did it look like these youth experiences were any different? So to answer these questions, we conducted a telephone survey. And just to give you a sense of, you know, a lot of ideas were thrown out about how we might go about this, in-person interviews, web-based interviews, working within the actual Department of Children and Family Services and having caseworkers conduct the study. And we really arrived at the significance, in order to maintain confidentiality, as close to anonymity as we could get, and to make sure that the questions were asked in the way they needed to be asked by people who were trained to ask questions about sexual orientation and gender identity. We actually resolved that the methodology of choice would be essentially a basic research design. And a telephone survey would also allow us to reach out to as many youth as possible throughout the county. And we fashioned it to some extent off of a study that we saw conducted in Washington State, but used a telephone research center that has conducted many large-scale health surveys here in California and nationally, and has also assessed sexual orientation and gender identity as part of that work. So the telephone survey used what we call computer-assisted telephone interviewing, which means essentially the interviewer, as they speak to the participant, kind of goes through a computer-assisted interview protocol that tells them, you know, where to go next, what question to ask next, and they record the answer right away. The contact information for how to reach the youth was provided by the Los Angeles Department of Children and Family Services. And one really exciting feature about this study, and was a benefit of working with WestStat, their telephone research center, is that we had an opportunity to use IVR. And what this allowed us to do is that youth, when responding, had essentially 3 options for how they responded. They could, so for example, in asking a question about what is your age, they could say their age out loud, they could actually say the number that corresponded to the response that they wanted to provide, or they could type in the number that corresponded to the response that they wanted to provide. And so this was a significant benefit and opportunity to protect their confidentiality and make sure that the, you know, hope to ensure that the responses they're providing are accurate. So in terms of who we wanted to interview, meaning, you know, what was our sampling frame, we were targeting and we requested contact information for youth who were in out-of-home care. They could be duly or solely supervised by the dependency court, but they could not currently be in juvenile detention, and the age range was 12 to 21 years. A great benefit to the study, or a great strength, is that we used random sampling to try to avoid biases with other types of sampling techniques. And we did what we call a stratified random sample, which means that we identified a group that we wanted to make sure that we got a significant number of participants in order to do various types of comparisons And so we oversampled the 17 to 21-year-old age group. This also allows us to compare to what other existing research is out there, which is tended to focus on transitioning age youth. Our final sample, we were out of approximately 3,000 youth that we tried to contact. We were able to complete over 780 interviews, and we had nearly a 42% response rate, which is really good. So who did we actually get to talk to? I just want to give you a few basic demographics before going into the, I'll tell you a little bit about the measure. We were able to, out of these 786 youth, the average age was about 16, but that's not surprising. It was actually by design, since we tried to ensure that we had about half that were 12 to 16 and half that were 17 to 21. The majority identified as female in terms of their sex assigned at birth. Most were ethnic minorities, particularly Latino, Black, or multiracial. And in terms of their placement, about 12% were in group or residential care. And in terms of place of birth, most were born in the U.S., but about a third had either a biological mother or father that had been born outside of the U.S. So before talking about the findings, I want to tell you a little bit about what we asked them in the interview and then how we arrive at who we're talking about when we say LGBTQ. So first, in terms of the questionnaire, what we asked them. The main sections of the questionnaire included a demographic section, and this is where we included sexual orientation, gender identity, and expression. Those terms together, you might have heard before, together, sexual orientation, gender identity, and expression. Some people use the term SOGI to refer to those three terms together. So the demographic section asks basic things like age and race, ethnicity, but also these SOGI-related type items. We also made sure to ask about discrimination based on actually multiple social statuses, so race, weight, for example, as well as the SOGI-related type social statuses. And by discrimination here, we're talking about experiences with forms of interpersonal minority stress, and that particular section was adapted from Alon Meyer's measure of minority stress that he's used in a number of studies looking at relationships between LGBT status and mental health. And then we also had several items looking at permanency-relevant factors in order to assess this issue of disparities. So we looked at the type of placements they were in, how many different placements they had in a lifetime in the last year, experiences with homelessness, and an indicator of emotional distress. So for the rest of the study, when we're talking about the findings, as I said, the main questions were about, are these, how many LGBTQ kids are there, and are there differences? So when I talk about LGBTQ, the way that was defined for this study was actually a combination of three different concepts. So there's sexual minority identity, meaning how do you identify in terms of being gay, bisexual, or lesbian, or heterosexual. And in this case, they would need to identify as gay, bisexual, or lesbian, or questioning. And by questioning, it means they said that they are not sure yet. Same-sex attraction, so that they note that they are either solely or in part experience same-sex attraction. And then transgender status. And for this study, transgender refers to those that either chose transgender as their current gender, or those that said that they were not sure yet about their current gender identity, as well as those that had a current gender identity that was incongruent with their sex assigned at birth. So to measure transgender status, we used a version of the recommended what's called the two-step approach, where you asked respondents, what was your sex assigned at birth? And then you asked, now tell me what your current gender identity is. So essentially, when I talk about LGBTQ together, it is anyone who said yes to a sexual minority status, a same-sex attraction, and a transgender status. And what that image there is showing you is that we made sure that we took out any kind of double counting, right? Because it's likely that those who identify as same-sex attracted also identify as LGBTQ, but not always the case, so we didn't double count anybody. But then also, in addition to this kind of main analysis group, for descriptive purposes, I'll also discuss some of the data on gender expression and discrimination, because we also saw kind of gender nonconformity and experiences with SOGI-related minority stress or SOGI-related unstable housing as other important indicators when thinking about the LGBTQ experience in foster care. Okay, so let's get to our first question. What percentage of Los Angeles County foster care youth are LGBTQ? So the very first finding here in terms of LGBTQ, we identified that approximately 1 in 5 or 19% of LGBTQ youth were, of foster youth were LGBTQ. But as I said, we looked at some of these other indicators. So when asking about discrimination, and as I mentioned, we talked about it, we asked them, had you experienced discrimination with regard to race, with regard to weight, with regard to sexual orientation, with regard to gender identity? When I look at just those who reported discrimination related to sexual orientation and gender identity and expression, we actually see that, again, nearly 19% report experiencing some form of minority stress, SOGI-related minority stress. And then the next two bars here where it says LGBTQ and same-sex attracted, this is where I said that LGBTQ, same-sex attracted, and transgender, essentially the adding of the three of these and removal of the overlap is what makes up our 19% at the top. But it's also useful to look at these separately. So approximately 13% self-identified with a label like lesbian, gay, bisexual, or said that they are not sure yet. And that's who we describe as questioning. Again, approximately 13% identified as being attracted solely to the same sex or partially to same sex as well as other sex. In terms of gender nonconforming, approximately 11% report meet the criteria for being categorized as gender nonconforming. To assess this, we asked them about how they saw themselves, how other people saw themselves as in terms of their masculine expression and feminine expression. And approximately 11% reported being very high on a level of expression of gender that was different than their sex assigned at birth. And over 5% were categorized as transgender, and again, this is using the two-step method that I mentioned. And nearly 3% reported having been kicked out or having run away due to their LGBTQ status or due to their caregivers' responses to their LGBTQ status. And that's in a lifetime. Okay, so before moving on to the disproportionality question, I do want to say that it should not be missed that the data definitely still demonstrate that racial disparities persist in the general population and among LGBTQ youth. So, for example, the legend to the right here, these first two indicate male assigned at birth, so males, all, and female assigned at birth, all, meaning if we look at the LAFYS data for the racial distribution of the overall sample, not removing or not focusing on those who are LGBTQ, we get this distribution, which in particular suggests a really high representation of Latino and Black kids, as well as multiracial kids, and most of these youth are part Black in further analyses. And a pretty significant disproportionality for Black youth in particular, given that, African Americans only make up approximately 8% of the Los Angeles County population. But there also appears to be a trend at the intersection of race, sex assigned at birth, and LGBTQ status that show a particularly disproportionate representation of Black LGBT youth assigned female at birth, meaning that when we look at the same distribution of those that are LGBTQ specific, these other two color bars, what we see is that we see the same kind of overrepresentation of Black and Latino and multiracial youth, but there's something going on here with the female assigned at birth youth that we're really interested in looking more into. In where there's 13%, where Black girls make up 13% of the overall sample, but 20% of the LGBTQ youth in our sample. Okay, so let's talk about disproportionality, that second question. Does it appear that we found evidence of that? Essentially, yes. When looking at, so these yellow bars represent, remember I showed you the tables where we had kind of all these different studies that have attempted to estimate sexual orientation and transgender youth, so sexual minority youth and transgender youth. If we look across them, I'm saying, approximately, they all kind of hover around 7%. The transgender youth estimates seem to hover around a little over 2% if we kind of look at the difference between the 1% and 3%. When we look at our findings for LAFYS, for sexual orientation measured through identity, we have, again, about 13% in terms of same-sex attraction, also about 13%, suggesting, about a 1.5 to 2 times higher rate of LGBTQ presence within foster care. Similar with transgender youth, approximately twice as much. So we would argue that, yes, this would be evidence of disproportionality or some level of overrepresentation. And as I said, it's significant, and Shannon Wilbur in particular, I remember early on in the project, made a note to remind us that, it's not just about saying, are there a lot of gay and queer and trans kids in the system, but how are they doing? So do we have evidence of disparities? When looking at all the different indicators that we measured, they were actually, LGBTQ youth were mostly similar than to non-LGBTQ youth, except in a few areas. So LGBTQ youth showed indicators of unstable housing, meaning they moved around more, to more placements, more likely to live in a group home. Like, for example, 26% of LGBTQ youth in the sample currently lived in a group home versus 10% of the non-LGBTQ youth. They also reported experiencing homelessness at a higher rate, at a rate of 21% compared to 14% among non-LGBTQ youth. They also indicated more emotional distress and yet less physical, and then reported less positive experiences in the foster care system. So, for example, looking at the emotional distress measures, the way we looked at this is that we asked youth whether or not they had ever been hospitalized, and then if so, for what reasons. And the reasons we categorized, or we gave them the options of emotional, physical, or emotional and physical. When we see this, we see that LGBT youth overall were hospitalized more or at a higher rate. And when looking at for emotional reasons, it was at a significantly higher rate. And we see the opposite trend with regard to physical reasons. Also, when thinking about disparities, as I mentioned, their treatment in foster care, they reported some differences there. We asked them, how do you feel the foster care system is treating you? And their options were very well, somewhat well, not very well. Well, you know, in one way, it looks like, in general, all youth, whether LGBTQ or not LGBTQ, they were reporting that they felt they were treated very well. Where we see the disparity is this not very well category, that among those that reported not very well, LGBTQ youth did at much higher rates, at 13% compared to nearly 6% among non-LGBTQ youth. So where does that leave us? So to conclude, essentially LGBTQ youth in out-of-home care in Los Angeles do appear to be represented at high proportions, more than we would expect by chance, and are faring worse on a few key predictors and indicators of well-being and permanency. And I know we'll get to questions and discussion, but just a few implications that I draw from this is that, for one, our study clearly indicates the need for investment in future research, so for example in other counties. And when I say the need for more research in other counties, it's not because I believe that what we're seeing in Los Angeles is not likely to be generalizable in other counties. There's actually no reason to assume that there are disproportionate, that the level of disproportionality is not similar in other places, and that this is just a Los Angeles specific phenomena. In fact, we know from much of the research that my colleague here, Gary Gates, and others have published that same-sex couples are found in 93% of the counties around the country. So we have no reason to assume that this is an LA-specific phenomena, but more research is definitely needed, both to document that for people who are likely to still not believe, but also to understand like the city or context-specific nature of disparities by other cities, that there may be something there to look at. More research also needs to look into explaining this disproportionality and disparities. I mean, this was not an in-depth study on the mechanisms or pathways of overrepresentation. Clearly, the data on being kicked out might indicate evidence that rejection from homes could be a factor, and treatment and the treatment and foster care findings might indicate that as a reason why they have had more placements. But there are likely other reasons and hypotheses that future research really needs to consider. And I'll just end with also just noting that I think the data looking at the intersection between race, sex assigned at birth, and sexual orientation and gender identity really highlight this need to not lose sight of intersecting oppressions in the work that we're doing. That is, when we're doing LGBTQ-related work in the foster care system, we are inherently also engaging in, or ought to be engaging in, forms of racial and gender justice work as well. So thank you.
Thank you, Bianca.
Questions.
Yeah, this is Bill.
Hi.
And I'll start with some follow-up questions and then let Kristen Weber continue.
Great.
But following up on the area of intersecting oppressions, a question I have, and it may not be something you saw in the research, but something you will have perhaps discussed as you looked at the data and analyzed it. It seemed like you had a higher percentage of female assigned at birth responses.
Yes.
And you also noted a high percentage of female assigned at birth African American youth compared to the general population. And I'm wondering if you could speak a little bit about African American males and whether they're less likely to report same-sex attraction for a variety of reasons, or to respond to surveys like this.
Right. Yeah, no, that's a great question. I mean, I've done some exploration, but I kind of see that as a topic of a next paper to look at in more detail. I mean, what I can say is that when we look at findings of, from the Gallup study that Gary Gates and colleagues have conducted, and here, that really was our first national probability sample of adults, including young adults, who identify as LGBT. What we actually saw there is that African Americans identified as LGBTQ or LGBT at higher rates than whites. And so, looking at research at studies like that, and women were also more likely to identify than men as being LGBT. So it appears that, so given that, I don't have reason to think that what was happening were that the black males, for example, or males in general in the study, were less willing to report, but rather many of the studies we're seeing around the country report a higher likelihood of women identifying with a sexual minority identity and engaging in same-sex behaviors. So, you know, my guess is, at least at this point, that the higher proportion of girls that are represented among the LGBTQ group is kind of part of that overall trend that we're seeing in other demographic studies, which is why, for me, the significant part was noting kind of this disparity of black girls in particular more than what we'd expect in the general population there, if that answers your question.
Yeah, that does.
Okay.
And obviously, a lot of the research you did with this study have many implications for future research. Another question, there's recently passed legislation, the Preventing Sex Trafficking and Strengthening Families Act, and within that act are provisions for states to look at moving forward with plans around using the prudent parent standard and working to achieve a system where young people in the system have much more normalcy in terms of their life experiences compared to the general population. And just if you could talk a little bit about your thoughts about the implications of that for LGBT youth.
Yeah. I mean, I think with that particular piece of legislation we see, like, there are two potential, like, strong implications that stand out for me. So, you know, one is this requirement for the investigation of AWOL or cases of youth that have ran away. So the investigation and documentation of the reasons that youth run away. So, you know, given that data seem to indicate that LGBTQ youth are experiencing running away or being kicked out due to LGBT status, both in our study and in other studies, you know, this could be an opportunity that we might see more formal documentation regarding poor treatment due to SOGI-related issues. You know, a level of formal documentation of that has been piecemeal or kind of idiosyncratic at best, right? You end up getting folks who feel really capable of documenting that as an issue, and it gets documented. Those who do not feel capable, aren't comfortable, or aren't aware of how to identify that that's the issue, then are not documenting that. And the issues with sexual orientation and gender minority stress continue to remain invisible. So I could see that requirement maybe as an opportunity to start, you know, getting a sense of, you know, and particularly with trans youth's vulnerability to sexual abuse and exploitation, you know, also the focus on identifying evidence of exploitation could have major implications for the group of kids that we're talking about. So, you know, I could see that there. You know, one thing I've wondered with the normalcy component. So, you know, that component of the law seems like it could have, on one hand, very important positive implications for youth in areas of the country where the presence of GSAs or other LGBT-affirming youth activities could be identified, because it creates a structure, right, for justifying LGBT youth, foster youth, also getting those opportunities of other youth in the community are getting those opportunities. But for youth that are not in areas, or for youth in areas where, yeah, the youth that are not in areas where non-foster youth have easy access to those kinds of programs, it's a little unclear to me whether the lack of those activities in the everyday life of non-foster care kids could become a reason to deny it for LGBT foster care youth. So I think that part of it, in terms of implications for LGBT youth, I'm still interested in seeing how that plays out.
Great, thanks so much.
Yeah.
Kristen, did you want to follow up with
Yeah.
some questions?
Sure. So we have some questions from the audience, and we encourage others to keep sending them in. So a few questions about the methodology. So one question was, did you ask questions about sexual behavior as well as sexual orientation and sexual attraction?
Yes, great question. And no, we did not. So there were, several areas where I'll say that we, as a collaborative and working very closely with the department, where we made some decisions about the level of kind of potential emotional, mental, or risk of what types of disclosure we wanted to ask by phone in this first effort at doing this. And excluding sexual behavior questions was one of the things that we, that definitely got cut. We decided to focus on identity and attraction. A number of concerns were raised about attempting a sexual behavior questionnaire by phone for the first time doing this, and so we opted not to include that third element of measuring sexual orientation. So something I assume whoever asked that knows that it's important to assess. It's something that I think would be great to do now that we can document that we were able to conduct a study like this in the first place. And my background is actually in sexual behavior among youth and HIV prevention-related research, and so we know we can ask the questions, but now we can demonstrate that we can both ask the questions in community research, we know we can ask the questions in school-based research, and now that we've demonstrated the methodology for asking any type of sexual orientation question by telephone survey, maybe we could now make that argument to combine all three to justify doing that next time.
Great. So another question was, someone wanted to know, can you talk more about how SOGI measures were modified for an adolescent audience? And the person wrote, for example, how was the two-step protocol modified?
Yeah, great question. So the two-step and the sexual orientation questions were, well, maybe I'll say this. So the sexual orientation question, I started with, taking a look at the document that we call the SMART document, a report that was published and through the Williams Institute, but it was a collaborative among many scholars who measure sexual orientation and provided recommendations to the field for how best to do this. One of the recommendations there for adolescents is to include a question that says, I'm not sure yet, particularly given the developmental period that we're talking about, although I'd argue could also be useful for adults, but particularly for adolescents and young adults, and noted the significance of asking or also asking or providing the response choice with, I'm not sure what this question means. So what we did is we actually included both of those. Our goal was to distinguish between those who are not sure yet and those who don't get what we're asking, right? Because it was still possible that youth, or anybody responding may say, I don't really know what you're asking me when you say lesbian, gay, bisexual. And we wanted to distinguish those. So that's how that wasn't so much a modification, but more following the SMART document and combining both those recommendations into one item, which allowed us to distinguish the questioning from those who, questioning one's sexual orientation from those who just didn't get what we were asking. And so the modification to the two-step was essentially applying that same developmentally appropriate options of I'm not sure yet and I'm not sure what this question means to the current gender identity question of the two-step. And so the kind of parallel gender identity document, many of you may have seen, Williams recently released, again, another collaborative with multiple scholars who study transgender and gender identity, recommend that two-step approach, and we added that kind of what we saw as a developmentally appropriate addition, distinguishing between questioning versus not knowing what we're asking.
Great. With the treatment in foster care and sort of the significant negative experience, did you all analyze further what was the experience of LGB kids versus transgender youth?
No, that's a great question, and that's kind of that is the next study. So, you know, the findings that we're reporting today is still combining LGBTQ, but you're right. What we need to do is also understand how their experiences are different, not just LGB from the T, but also LG from B, you know, since a number of studies also show distinct experiences between bisexual people and same-sex only attracted or orientation identified folks. So those are next steps.
And then somebody asked, did you happen to ask the youth whether they are out to CFSA staff or other, so I guess department staff or other providers in out-of-home care settings, and any related experiences related to them coming out or being outed?
Yeah, no, we didn't ask that specifically. So what we did do as part of the minority stress measure, I mean, that was essentially our opportunity within this brief survey to find out whether or not they'd experienced, you know, it was several items, and these are all, the entire measure is actually an appendix to the report, which is on the Williams Institute website. And so in that you'll see that we ask, you know, have you felt disrespected, you know, kind of these several indicators of minority stress. We asked if they experienced those. Then we asked them for what social statuses or what reasons they felt they experienced those because of their race, weight, which, by the way, those two statuses remained highly reported statuses for which they experienced discrimination, both race-based and weight-based, but also sexual orientation, gender identity, gender expression. And then a final question asked, in what settings did you experience this? In foster care setting, school setting, and so forth. So that's as close as we got to the kind of great question that the questioner is asking me today. So not exactly what they're asking about, but that's how we tried to assess that issue.
Great. So I have another question in the queue, and I think we're almost at our time. So if somebody has another final question, we encourage them to send them in. So this question is, where did the statistics on LGBTQ youth in the general population come from, the yellow bar on the chart in the presentation?
Oh, okay. Here, let me do, okay, so these yellow bars come from a very crude average of these two tables. So the sexual orientation bar, that first yellow bar, is a crude average of these multiple studies. I mean, you can't take this as a true average. This is not a detailed meta-analysis that accounted for their different sample sizes and so forth. But it provided a way to graphically represent this range of 4 to 8%. Similarly, and we were relatively conservative, right, by saying that they average at about 7%. You know, the higher I say that average is, the more conservative it is, because it could suggest no disproportionality for our study. But that's where those come from. So sorry if I wasn't clear about that. Similar with the transgender status, looking at it somewhere between 1 and 3% gets us to these. About 7%, a little over 2% for those averages across the studies.
Great.
That's great. I think that's it for the questions, right, Kristen?
That's right. That's right, Phil.
Okay. Well, let me say first, Bianca, thanks to you, your colleagues, your collaborators, for the survey and report you've all done, given the lack of information we have. It's really groundbreaking, I think, in terms of helping to move us where we need to go with more surveys, more research, more studies. But at least we have something a little more tangible now for all of us to share as we move forward with the work we're all doing that kind of begins to have a foundation for what we've anecdotally been saying about the needs of this population of young people. So thank you for that. This session is going to be recorded. It is recorded, and we'll be sending out the link to all the network participants and posting the recorded version on our website. This will be the last webinar for this year. The next webinar, just so you know and can calendar it, is January 22nd of 2015, where Cheryl Statz from the Kirwan Institute will do a presentation on the implications of implicit bias in our work. So again, thanks Bianca, and thank you everyone. And this is it. Thank you.
Great. Thank you for having me. Goodbye.